Clap your hands. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Stand up, Sam.
There you go.
Good posture.
There.
Today, we're going to talk about best shoulder pain exercises for fast and effective relief. This is a method by Dr. Kirsch. He's a surgeon, orthopedic surgeon, right?
certified, yep.
And he wrote a book. I'm sorry, am I jumping in on you?
Go ahead. No, you go right ahead. This is an excellent book, and it's made not specifically for the layperson, but it's pretty good.
Yeah, the layperson can read it, but there's a lot of it gets a little technical.
Right, but any therapist that treats shoulders definitely should get this book for sure. But it's a wonderful book, and
we'll have it listed below in the
you
link.
better believe it.
Right, Liz? Actually, it's on our Amazon page now.
Sure, yep.
So, by the way, if you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, if you get the chance, go over to Facebook, Bob and Brad, and like us, because we're going to give you out positive vibes if you like us.
Not to mention a good shoulder.
Yeah, a good shoulder, too.
Okay.
All right, Brad, what's this all about?
Well, this particular theory, the Kirsch method of correcting shoulder problem, when I first heard it, it's like...
I was skeptical.
Right, so was I, and then you actually got the book.
Right.
And I read it, and you read it, and it's like, oh, this really makes sense. So we're not going to go into the detail of all the biomechanics of it, but we are going to talk about the concept of the big thing with shoulders is there's a ligament right here that connects your coracoid bone right here, this little bone here. You can see the blue tape represents where this ligament is.
So you put blue tape over there to highlight where this ligament is that we're talking about.
Right, exactly. Can you see that, Liz, right there? Now, if that tightens up, that doesn't allow the shoulder to move near as freely as it normally would. So over time, and depending on your activities, when that tightens up, it causes problems. Also, you can have bone spurs right into the acromion here, which causes the red line right here. That's the supraspinatus tendon, which is very commonly the involved tendon that causes pain. And you can see when you bring this up, see how that can get
pinched in there.
Pinched right there. And that's the impingement syndrome that is so common with shoulders. So if we can stretch this ligament out, or with Wolff's Law, which is another part of the book, they explain how this bone can be over time reshaped so that you get room so the shoulder can work functionally overhead and eliminate those problems.
So if I were to summarize, Brad, overall by stretching, you're creating more room.
Precisely,
and there's more room for the shoulder to work, and there's less pinching going on, less obstruction going on, and less pain going on, hopefully.
And with surgery, that's exactly what they do. They'll go in there and they'll take off some bone right here. They don't cut the ligament, but hopefully
they're creating space.
Right. So why don't we just create space? And this is what Dr. Kirsch says. He's been doing surgery for years, and it's like he figured this out, how we can create space conservatively and very simply. Right. So let's show them how, Bob.
And you should, I don't know at what point, but you kind of should talk about your shoulder, Brad, because you just recently had stopped doing this for a while.
Right. I had been hanging over the winter time because I swim a lot, which can be a shoulder problem. So I quit doing it because I was going to the Y, and I don't do that in the summer because I'm outside so much. Sure enough, shoulder pain coming back. So 2 weeks ago, I started hanging.
Yep.
I'm already improving. It's amazing how quickly it's been working with my shoulder.
And I can tell just from my standpoint too. I do kind of hanging, and then I do pull-ups.
Sure.
And 10 years ago, I had so much. I had pain in my shoulder when I did them.
Sure.
And now they feel great.
Right.
And I'm 10 years older, Brad.
10 years older than what?
Than I was when I first started doing it.
I thought you said meant than me, and it's like, no, you're not that much older. Okay, let's get to the exercise. People always get there.
We talk too much.
Right, we talk too much. Sorry, it comes with age. All right, so we're going to hang. So you just get a pull-up bar, and it's nice to have one that's not really high up. So when you start, you're going to hang for 10 to 30 seconds, and oftentimes you're not going to hang with all of your body weight. It might be too aggressive. You may have to partial hang, so that's why a lower one works really well. I'm just going to bend my knees, and I'm just going to relax the shoulders.
And if your hands are kind of tender, you might start with gloves.
Right.
He recommends that, kind of a grip glove.
Right. Good point, Bob. So I'm gonna hang like this, and if it's painful, that's normal. So you're gonna, if it's real painful, you know, maybe 10 seconds is all you can do, and you may only be partial body weight. Right now I got about 50% of my weight partially hanging, and then you're gonna relax. Give it a minute or so, and then you're gonna go back and do it again. And you're gonna repeat this over and over, and he says up to 10 minutes. I usually don't go that long.
I don't go that long either. I mean, that's a long time.
But he talks about it takes time. You're not going to stretch that ligament in one session.
Yeah, this is a heavy-duty ligament, and if you're reshaping bone, I mean, this takes, we're talking weeks and months. Right. But hopefully you start seeing some, like you saw improvement right away. Almost.
Right, but mine wasn't too serious. And I had been hanging before.
Sure.
So I needed a little tune-up, so to speak.
Boost, yeah.
And as you get better, then you'll go to full body weight hang, you know, and just hang there and just relax. And actually, for me personally, this really is a double benefit because my back really feels good after I do this as well.
Yeah, we just did a video on how this can help put a little bit of traction on your back all the way, you know, throughout much of the spine. So it actually can, you're getting a little bit of a double benefit. You're getting the posture too. It's helping straighten your posture out a little bit too.
So again, you can hang up to 30 seconds and you're going to do it repetitively. And this can be a daily exercise for you. And it's so simple. You do need something to hang on. That's probably the biggest.
That's the biggest obstacle.
Right, that you need to overcome. I know with my shoulder, swimming was getting, because I swim a lot in the summertime, it was getting to the point, it's like, oh, I got to start hanging. And I was doing 500 yards, my shoulder started bothering me. This morning I went 1,600 yards, and feel much better. It's not 100%, but it's 90% better.
Sure.
So
that's a good testimony.
You bet. And we've had a lot of people comment on the hanging video that we put up a number of years ago, but I wanted to get back to it and go a little more detail.
Now, he does recommend some exercises too, as far as strengthening, right?
After you get done hanging, start with a light weight, particularly if your shoulder is sore. So we're going to start with a 1 pound.
It's nice. How nice of Brad to bring in his pink barbell today.
There you go. Okay, so we're going to start out just going to 90 and just, you know, as many repetitions.
Slow and controlled.
Right.
I mean,
now he recommends up to 30 to 45 repetitions of light weight, but you have to use good judgment. If it's real painful and you're just working through the pain, you don't do that. You may only start to 90 degrees if it's painful, and if you only do 3 or 4 reps and it starts to get painful, just stop. Then you're going to go out to the side, same thing. Now, I don't have my shoulders don't go up real high naturally.
Don't you kind of externally rotate the
palms down?
Oh, palms down.
Palm down. Good point, Bob. He's very specific about palms down.
Yeah, this doesn't make sense to us, but we're following his program.
Right, exactly. I'm going to do it.
And how high up?
As far as you can get it pain-free.
Forward too?
Yep, forward and out to the side.
Not just to 90 then?
Nope.
Okay, all the way up.
As long as it's not real painful. It may take time to get to this.
Sure.
So this all evolves over, you know, possibly a period of weeks.
Sure.
And then he wants extension, I'm sorry, palm down this way. Now, in his book, he shows going forward like that. I'm thinking that's going to bother some people's back. If you got a back issue, or make sure you
support yourself
and do it that way.
Now, I have to be honest, I have not done that part of the program.
The strengthening with the weight. Yeah, because
I do my own strengthening.
Right.
And but I definitely like the hanging.
Yeah. We're going to do a video again in detail on a study that really goes into a little bit more detail and how successful this was with real shoulder problems. It was 92 shoulders, as a matter of fact.
Nice.
Really good success. So that'll be coming up in the next week or so. So, Bob, once again, this, I think, is getting closer to what we're trying to fix.
We're trying to fix a broken heart.
Right.
But we're working on it because we haven't been successful so far.
Right, but it's coming. Every step is a little closer, Bob.
Yep. We're going to be kind of like the Ann Landers. Do you remember that?
Ann Landers?
Yeah. Or Dear Abby?
Yeah, that was a newspaper. Back when they used to have paper newspapers.
Yeah, that's right. Thanks for watching, everybody.